And we're live. So, and then just read comments that are interesting to us.
Very good.
So, Dr. Mark Vaughan, Auburn Medical Group. Tim, is it okay if I identify you?
Sure.
Is it okay if I say that we were in the same high school class?
We were.
We were in the same high school class. And we're just doing a quick little live video because people love watching procedures at Auburn Medical Group. And Tim has this mysterious spot right here. And it keeps coming back even though he cuts it away. He's had a CAT scan, ultrasound, and plain x-rays. None of them show something here. He's actually seen a podiatrist who suggested cutting it back on regular intervals. And our solution is to do a punch biopsy where we just core this out and then suture it closed and send that off to a pathologist to find out what it is. For now, I'm going to clean this off with some antiseptic. And then we'll get started.
Slide in right there.
Yeah, I'll get that. Yeah, we'll do it with this. And I'll just use the non-sterile gloves for. So do we have any of our regular St. Hyde? The ones with the little Auburn Medical Group logo, make sure to mention them. Those are
Oh, someone says ciao from Italy.
Oh, cool. Somebody from Italy's watching us.
Michelle McDade says hey.
Okay. So clean it off.
Oh, Bianca says hi. That has the logo.
Yes, Bianca's one of our channel members. Channel members get special recognition.
Jesus says hi, Dr. Vaughan, my favorite YouTube doctor.
Oh. Yes, there are people who watch YouTube doctors. Did you know that, Tim?
I was not aware of that, actually.
Are you a Dr. Pimple Popper fan?
I'm not familiar with him.
You're not familiar with that one?
No.
She actually has her own show on TLC? I'm not sure.
Yeah, it is Chelsea. Angela says hello from the UK.
Excellent.
Paula says hi, love to watch.
Wow, that's so cool.
Global.
Really is. Okay, Tim, there's just no good way to do this for the shot, so we just got to do it. I'm going to hold on a second here. With the anesthetic, it's actually kind of hard to tell where the spot was, so I'm going to get a sterile gauze here and just do this just to, there it is, okay. So forgive me for this part. It is going to hurt, but please do try to keep it rated G. And try not to kick. All right, here we go. This is the bad part. Sorry. Wow, you are so totally still. Oh, now you feel the sting. So this is the anesthetic that we had talked about before going. And we're putting in a lot because it's nice not to feel painful procedures. And it's actually really slow going, partly because of all the calloused heel. It's harder to get it into. You still feeling it, Tim?
Yep.
As bad, or is it good?
No, not as bad, but still a pretty good thing.
And you're going to feel a lot of swelling, but we like a lot of swelling there because it gives us a lot of numbness to the area.
Rhonda says hey from Knoxville, Tennessee.
Oh, hey, Rhonda. So those who are just getting in here, because this is live and people join it in the middle of it, Tim has a painful spot on his heel. Almost looks like barely a little bit of callus growth before we put on all the betadine. Evaluated by CT, ultrasound, and plain films by a podiatrist, and still there. With the proposal was to shave it down every 2 weeks. Is that right, Tim?
Correct.
And Tim, my high school classmate, actually comes to me to do things like this to him. Okay, so now we're going to put on sterile gloves. Yeah, I might want to get more of the room.
Okay.
it's not just a single shot.
Yeah.
Although it was a single shot for anesthesia. All right, so while that's working, we will, I don't know how much benefit we're going to get from the drape, but we'll put the drape on anyway. A little bit, when it comes time to sew things up. I'm going to get the suture ready ahead of time. We'll need scissors, so I'll have them handy. I'll do the scissors first. And I'll need this too.
Michelle is from Scotland, and then there's another person from Kent, England.
Wow. What an audience. Okay, I think this is how we'll do it. Is there any way you could throw a chucks right there while doing that? Okay. Just in case blood drips. We want to be prepared for it. Okay. I can get it from there. So again, for latecomers, Tim has a spot that is painful when he walks on it. It's keeping him from working. And it looks different after you numb it up and use anesthesia. And I can feel, you can see the little brown spot there. That's part of it, but feeling it, there's like a more of a firmness that surrounds it. Tim, do you feel anything I'm doing?
No, I mean, I can, in my foot I can, but it's definitely not in the air.
All right, so we're going to take out 4 millimeters around that.
Bianca says, I wonder if he stepped on something.
Well, nothing that's radio opaque anyway.
The timing was suspicious with me breaking the glass in my workshop.
Breaking glass in the workshop seemed to
I cleaned it up
correlate.
about an hour later, I stepped on something and it hurt, and 8 months later, here we are.
And 8 months later. Wow, that really is thick keratin there. I'll get the sharps later. And
Dawn is asking if that's a corn on the heel.
it may just be a corn. That may be all it is. It's just a real funny sort of situation that it's so focal here and it doesn't seem to really be in an area that's sticking out. All right, so what we're going to do is put this over so afterwards it can be put in a specimen container. Not a whole lot of bleeding because in addition to the lidocaine, we also used epinephrine.
Jessica would like to know if it's painful, Tim.
No, not at all.
Not at all.
Normally, yes, right now, no.
Normally when you're stepping on it, it's painful.
Right.
And the keratin in the heel is really, really thick. So getting a suture to go through it is actually a bit of a challenge. I went with 4.0, but now thinking I probably would have liked 3.0. That would be a thicker suture. But given how little bleeding there is with this and how nicely this is going, I think we'll be content with this. All right. I may put in 2 sutures. We'll have to get the suture out in about a week.
Okay.
All right.
Jesus says Dr. Vaughan is very gentle.
Oh, thank you, Jesus. Would you agree, Tim?
I would definitely agree.
Yeah.
Bianca would like to know if it would heal without the stitch.
Yeah. Well, it would. It's just you'd be at risk for getting stuff in it. Yeah, we don't like things getting in the foot, because feet have a way of just not being the cleanest part of the body. It comes in contact with the ground where everything falls and bacteria live there. So probably better to close it. I'm going to put another one right next to that just because I like things closed nicely. Yeah, you can see there how that stuff takes a bit of force to get started. And then, because the radius of the needle is kind of like a minimum distance from where you go in that you're going to come out. So you can't make tight turns because you can't bend the needle inside of the skin.
Amanda would like to know how long it will take to get the results.
Oh, results will probably be in 2 days, but we have a difficulty with giving results because we get permission from patients to, you might be able to do the pinch squeeze thing to get even closer.
Okay. Oh yeah.
Yeah, to get consent from patients when we know what the results are, or it's a little more of an issue because, what if it turned out to be cancer or something like that? Not in this case, I don't expect that.
It would be technically okay for me to comment on the post later, correct?
Yes,
That's
if
my own
Tim
personal
commented,
opinion.
he could tell you once we get the results. So I'm no longer sterile. I'm throwing away all of my sharps. And Tim, we're going to have a bandage on that very shortly.
All right.
I just have to. So then we'll also have to put the specimen in. So I can actually throw that away too. Into the red can. All right, I'll go ahead and take over that
Okay.
if you do the dressing for me.
Yes.
So I'm going to switch this around so I can say goodbye. Tim, did you want your face on it at all?
Oh, cool.
Oh, Dr. Gawain comments, says he's working. I guess somebody was asking where he is. And he writes on YouTube, comments that he's working. I'm sorry, did you say you wanted to be on it?
No thanks.
Okay. Tim says he's okay not being on it. And Bianca says, not much when watching. I'm jumping in the middle of the conversation. So thank you, those of you who are new to our channel and don't know what this is. It's just a channel where we talk about medical topics, and every once in a while we'll throw in a procedure. Sometimes we'll actually stream them live as we're doing them. Go ahead and subscribe if you're interested, and there's a little bell icon you want to hit also. Otherwise, it really doesn't do any good to subscribe. The bell icon is what actually gets you notifications of videos when they come out. And you can see people from South Korea are part of it. Channel members like Laura Spirz. Channel members are people who hit that little join icon and they get special recognition on the channel. We pay more attention to their comments and questions. Until next time, Dr. Mark Vaughan telling you to stay in good health.